Hello my students, and welcome back to SP 3673, Assessment of Students with Autism. Other developmental disabilities. Alright, so we started this course with an introduction to autism, other developmental disabilities, intellectual disability, and then we proceeded to talk about two general approaches to evidence-based practice. Right? So evidence-based practice as an intervention, or evidence-based practice as the professional behavior of the practitioner. And probably the best approach to assessment and instruction of students with autism, DD and ID, is to combine the two, right? So if you're using the evidence-based practice in ABA as your professional behavior, when you incorporate the best available evidence into your teaching practices or interventions or treatment plans if you're outside of a school setting, then you're drawing on, in part, when you look for the best available evidence, you're going to look for high-quality studies and studies that have been classified as evidence-based practices by various professional organizations. Right? Okay. So that's the evidence-based practice, and then we proceeded to talk about an overview of curriculum development, where you really just kind of get an overview of where to begin when you're starting to assess the students' current levels and select goals for them that ultimately will enable them to meet or to successfully transition across different stages of schooling and ultimately to reach wherever it is that they're headed in post-school life, so wherever their future educational setting will be, or living or work setting. And so after that, we talked about some general teaching strategies based on applied behavior analysis that you can use to teach many of the skills that you would identify in an assessment and for which a student would have goals in their IEP that would be part of the individualized curriculum for that student, or outside of a school setting, part of the curriculum for your client. And now what we haven't done is we haven't talked much yet about specifically assessment of academic skills. And we're going to get to that. We're going to get to behavior analytic assessment of academic skills. But there are some foundational concepts to master first. I'm going to prepare you to better understand what an academic assessment is all about, why it's done the way it is, and how to interpret the results. So what we're going to do is, in this unit, we're going to cover some foundations of direct behavioral assessment in school, and largely this is about direct behavioral assessment of academic behavior in students generally, but this will be also highly applicable to students with autism, other developmental disabilities, and intellectual disabilities. And towards the end of this unit, after we talk about some of the foundations, we're going to also talk about something called a high ASR approach to instruction, which is also useful for ongoing formative assessment of students' performance largely in groups. Now it can be used for individual students as well, but it's largely used to assess student performance in groups. And there are a lot of benefits to a high ASR or creating many frequent opportunities for students to emit observable, measurable, relevant academic responses to instruction. And so we'll get into that. And so let's proceed with our outline. And so the outline today is that we're going to cover the foundations first. And then we're going to talk about direct observation and measurement of academic skills. And then I'm going to introduce you to the behavior assessment funnel. Now, if you took 3633 classroom management with me, or someone else who's taught the course with my curriculum, then you would have been exposed to the behavioral assessment quasi-funnel, which describes the process of functional behavior assessment as it pertains to challenging behavior. Okay, and so that same process of starting broadband in scope, considering many variables that may control the challenging behavior, and low in fidelity, which would be indirect assessment and preliminary screening, and then proceeding to types of assessments that are narrower in scope and higher in fidelity, so moving to direct assessment, functional analysis, progress monitoring, and so forth. So that whole process can be applied to the assessment of academic behavior as well. So that's what I'm going to do. I'm going to draw parallels between the behavioral assessment quasi-funnel conceptualization of assessing challenging behavior. I'm going to draw parallels between that and the assessment of academic behavior. I want to say in advance why that's important. It's going to be extremely important because despite all of the wonderful tools and approaches to ABA approaches to assessment that you're going to learn in this course, in reality, you're only going to be able to be so thorough with your assessments for any given student in your class, because as we've talked about earlier in this course, for most students that you serve in special education, especially children with autism, developmental disabilities, intellectual disability, is that they have far more needs and far more things that need to be directly taught than you're going to have time or resources for, right? And methods that comprise an applied behavior analytic approach to assessment are very clearly rigorous, right? They're clearly rigorous and labor-intensive and time-consuming. And there's a continuum. Some are more time-consuming or labor-intensive than others. And so ultimately, what you have to do at the classroom level is something that's similar that's done at the school-wide level, which is you have to determine which of your students are going to need more intensive or more frequent assessment, right? And then allocate the time that you have to do that to those students. And for those individual students, then narrow down, which skills do they need the most intensive assessment and instruction on, and then you narrow your focus, within a given student, which skills are you going to spend your time using the most rigorous methods on, and so forth. So, there's the same idea in the classroom with a set of students as there is across the whole school, where there's only so much time and resources to address so many challenges or problems that you encounter, and so you have to have a way of making decisions about where you're going to allocate your time and resources as a teacher. The same is the case in a clinical setting, if you're working in a clinic or if you're working in home-based ABA programming. We only have so much time and resources. Okay, so what I think is one of the things that I think is going to be very useful from this unit in particular is to start to conceptualize the allocation of time and resources and assessment using a behavioral assessment funnel, a variation of the quasi-funnel. Okay, so now next we're going to proceed with assessing school time. In this course, you're learning about methods for not just assessing behavior, but assessing the environment, and then also, in this case, assessing how time is used in the classroom. And then, we'll talk about high ASR methods for assessing academic responding. Okay, so the main ideas here, there are major advantages to direct behavioral assessment of academic skills. And although they are complex, direct behavioral assessment of academics can be managed within the framework of the behavioral assessment funnel I'm going to tell you about. And behavioral classification of the problem during assessment is prescriptive, meaning that it leads directly to selecting appropriate interventions from the literature, from the scientific literature. And that's a major advantage of a behavioral classification of student problems than other ways of assessing or classifying student problems. So, assessing the use of class time is also essential for optimizing what's called academic learning time. And then high ASR is useful for maximizing academic learning time and assessment at the group level. Alright, that wraps up this kind of introductory video part. I'll see you in video part 2, and we'll start discussing foundation.